This is going to be a prone hypothenar mammillary push, L1 to L5. Indications being restrictions in lateral flexion, rotation, or extension, or malpositions in lateral flexion, rotation, or flexion. Now, first thing I need to do is to make sure my table is set the way that I want it. Headpiece is slightly down. Thoracic piece is slightly lowered to create extension and pretension in the lumbar spine. And the pad of my foot piece is underneath the ankles of the patient to support the lower extremity. Now, also, I want to have the patient's ASISs just at the top edge of the pelvic pad. And once I get the patient set on the table as I need them, I need to get positioned myself. Now, I can either be in a modified fencer stance or a square stance, and I'm going to be demonstrating using a square stance today. This will be a unilateral contact, meaning I'm only using one hand to contact the patient. My indifferent hand will be supporting my contact hand, wrapping the wrist. I'm going to be in close to the table, and this is going to be an ipsilateral contact. So the side that I'm standing on is the side that I am contacting. This is the patient's right side that I'm standing on, so I'm contacting the right side. It will be, for example, for a left rotation restriction. Now, based on the segment that I'm contacting, I will either be using my superior hand for L1 and 2, or my inferior hand for L4 and 5, and at L3, I can use either one, whichever feels most comfortable. So let's start with an L2 contact. So I'm going to find my segment here. I'm going to take my tissue pull, and tissue pull is going to be P to A, medial to lateral, S to I. So I'm going to slide out just a little bit with my superior hand. Then I'm going to wrap my wrist, support my pisiform here, and I'm going to be over my contact. Now this time, I'm actually going to lean toward the feet of the patient so that I can get a line of drive, which is going to be P to A, I to S, here. Now, if it were, say, an L4 contact, now I'd be down at L4. I'm going to take that same tissue pull, P to A, S to I, medial to lateral. I'm going to slide in, wrap my wrist, protect my pisiform, and this time I'm going to lean a little bit toward the head of the table because I'm going to thrust P to A, I to S, and that's it.